With that introduction, sort of an overview of what we're dealing with, the science of this thing, I will pass it on to our Frank Lucido here, our good friend and medical doctor from Berkeley. About some of the implications of this.
Great. Thank you.
I don't know how to turn it off.
Just close it.
Close it. Well,
Hi, my name is Frank Lucido, family practice doctor in Berkeley since 1979, and for the last 12 years almost now, I'm a medical cannabis consultant, and it's about a 50-50 practice. I'm also an employer, and when I had a management consultant about 20 years ago come up with one of these boilerplate employee manuals, Danielle Schumacher's been working with us now for a couple months, really happy to have her. You'll get to see the employee manual. When I first got the boilerplate, it said something about we do drug testing, and I looked at the consultant and I said, I'm not doing that. And of course, I'd hate to have to fire somebody just for having a clean test. So anyway, the important thing is impairment, and as Dale has pointed out, a blood test, urine test does not correlate with impairment as far as marijuana. Now, I'm going to talk about 5 patients, but briefly I was one of the early doctors that got investigated when they were investigating 12 of the 20 most outspoken doctors. I created the website MedBoard Watch because I and others, David Bierman and Dr. McMaria, we used to go to the medical board, and I've been going to 12 of the first 14 quarterly meetings testifying about doctors being inappropriately investigated. And at this point, the outgoing president of the medical board has been supportive of me and referred patients to my website, as well as one of the other cardiologists who's on UC Davis's staff, who's on the medical board, has referred a patient to me. So I feel pretty good about having established the fact that it's safe and appropriate to make recommendations. And my blog has a few of the things that have been important to me to write about, and you do a website, MedBoard Watch will lead you to my website, and then of course you'll see my blog. And my title of my blog is Dr. Frank Lucido's Bully Pulpit, and the subtitle is Everybody's Entitled to My Opinion. My girlfriend gets tired of hearing me talking about it, so I got to find new people. So it's just on there once, read it once, I won't have to keep boring you with it. Now, I'm going to talk about 5 cases, I'll be brief. So one of the, 2 of my patients were RNs. One worked for the registry for 20 years. Her supervisor loved us, but because of one of her employees that she got sent out, her employer, she was forced to have a drug test. She was positive, it did not have medical, even though she had good medical needs. So she became medical, but still was punished for the positive test. There was another RN, though, who had already been had her medical and had a valid reason, was bipolar, was helping her, and was not drug tested. Then it was a sudden first-time drug test, a surprise drug test, and she was, she refused to take the drug test and resigned. And it's questionable. In fact, I remember now why she didn't have a recommendation. This was before 1996. Then there was now this one is not a patient of mine, it's somebody I knew in another state. He was a career state civil service employee. After 20 years, somehow the state civil service board mandated drug testing. He not only lost his job, but he can't reapply to that job for something like 6 years. So some examples of patients that patients or non-patients that have been discriminated for positive drug tests. Fortunately, this is going to hopefully change in Michigan, where it's going to be on the ballot in my home state, and I believe it's got over 60%, something like 67% in favor, according to polls. So I look forward to Michigan being the next state. Another patient who was a stewardess. She only flew in California, but she didn't realize that even though it's legal, this is FAA rules. So she was so afraid of failing her drug test, she took an adulterant. She would have passed the drug test because she wasn't that much of a user, but she failed the drug test because of the adulterant. They test for some adulterants. So Dale may have an idea of which things are okay and which things are not going to show up in your urine. let's see, and then another person that I've seen was the founder of a nonprofit, the own nonprofit he had started to help disabled kids. One of his kids had one of these serious disabilities. He was not subject to drug testing, but he was reportedly seen using cannabis. They made him take a positive test because they made him take a test. It was positive, and he lost his position at his own nonprofit. And he came to see me afterwards, and I think that case might still be being appealed because he had a valid reason to use it. He did not have his recommendation until after the fact. He even had a psychiatrist that I would consider one of the drug warriors. His name gets mentioned along that, but this was a friend of his, and the drug warrior went out of his way to try to justify how this patient was actually, in spite of the fact that it's the drug that most people are not better on, according to this doctor, it seemed like he clearly did benefit. So even one of the drug war people knew that this patient did better with his depression and anxiety. So those are the main cases that I wanted to go over. Gary Ross versus Raging Warrior notwithstanding, and I do in the questionnaire that I use, which is a modified TOD, I call it. Right now, the Society of Cannabis Clinicians has the health history questionnaire that a lot of us use. I use my version of a 10-year-old one that Dr. Todd first made up. And it does ask, are you subject to workplace drug testing? And so whenever somebody says that they are, I always make a point to mention federal versus state law. And of course now I have to give a little disclaimer because of the Gary Ross versus Raging Liar, which I think was such a bad decision. I think those are the main things. Check out my blog, do a Google search at Frank Lucido and blog, and you're going to find it. And one of my recent postings will be Hunter, Willie, Tommy, and me. I was asked to be on the NORML advisory board a couple of years ago, and when I realized that Tommy Chong was on it, Willie Nelson, and then Hunter Thompson had been on it until he died the previous year, I had to ask Keith Straub the obvious question. I said to Keith in an email, I said, I know nobody could actually replace the late great Hunter Thompson, but would it be fair to say that it took Chief of Police Norm Stamper and I and a Tommy Chong to boot to try to replace him? And he answers back, actually, you've joined Hunter on the board. We keep his name on the masthead in memoriam, and to date, no one has asked how a deceased member can give advice. But suffice it to say, those are large shoes to fill, and I too would opine that if I was in your position, that I was asked to step in and replace Hunter. It's an honor, even if not everyone understands it. Hope all is well, and I'm proud of that. All right, so I'm replacing Hunter along with a couple other members.